Hi, it's Alex again, paramedic, traditional acupuncture practitioner and osteopath, and co-founder of Holos Healthcare and Training Limited, an industry body approved first aid training organisation. And I'm here today to share some top tips with you regarding first aid. A problem I want to share with you today is a question often asked to me on my first aid courses is what would happen if I come across a situation at home, in the street or at work, and I'm there and my mind goes blank, what do I do next? Over the next few minutes, I'm going to share with you my thoughts on the matter, together with a situation I came across, to example how I would deal with that kind of situation. This one slide, in my opinion, encapsulates all the life-saving skills required in first aid. And that's a checklist. You might have heard the expression doctors ABC. This checklist, Doctors ABC, is otherwise termed the primary survey, and it's a checklist to identify what's going to kill your patient in the order it's going to kill them in. The idea is to identify and treat life-threatening conditions, and then move on to the next step. So what do you mean by Doctors ABC? Well, the D stands for danger. And the little expression we say here, danger, act first. And this act first expression sort of covers, ideally, in an ideal world, the things we should encapsulate in our danger assessment. And A stands for assessments, assessing the scene for any obvious hazards, because what's affected a patient may also affect you. C stands for communicate, call out for help, if necessary, call for an ambulance, and call out for further resources. Friends, work colleagues, and bystanders, etc. And T stands for triage. If you've got more than one person, you'll decide who you're going to have to treat first. And it comes from the French trier, to sift or to sort. And you might have heard of the word triage, nursing casualty. They sift and sort and prioritise care. And again, on our courses, we'll actually explain a bit more about this. After your danger assessment, you move on to assess the patient's response. And ideally, you would have done that already by, as you approach them, speaking to them. Now, if they're speaking to you at the get-go, you know they're alert. If they're not speaking to you, you can go up to them, give them a gentle shake and a shout and see what happens. If they wake up and tell you I'm just sleeping, that's fine. If there's no response, we deem them unresponsive. You can move on to assess their airway. And in this technique, we actually check, clear, open and maintain. Especially if someone's unconscious, we check the mouth. We open the airway to lift the tongue off the back of the throat, and we keep the airway in an open and maintained position. If the airway is open and clear, we can move on and see if they are breathing. And ideally, we check for 10 seconds. 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. And believe me, when someone's actually unresponsive, 10 seconds is a long old time. And we're looking for ideally 2 rise and falls of the patient's chest in that 10-second check. And that if you open up their airway and all you see is just 1 rise and fall or nothing at all, we deem it as no breathing. If there is only 1 sort of rise and fall, it could be an agonal breathing, which is not normal breathing. It's a reflex action by the brainstem. And again, we'll discuss more of this on our course. But you're looking for 2 rise and falls of the patient's chest to ensure there is normal breathing within your 10-second threshold. After A comes B. After B comes C. And C stands for circulation. But it's the circulation of blood around the body. It is not doing a pulse check. That was dropped in the 2005 guidelines for signs of life. So what do you mean by circulation? Well, quite simply, if they are breathing, the person is alive, they have a circulation. So circulation here means look for any obvious bleed and deal with it. Apply pressure, elevate the limb, and apply dressing as appropriate. However, if the answer to B is they are not breathing, as far as we're concerned, they're clinically dead, in which case circulation here means get help, if it's not been done so already, and commence CPR to maintain an artificial circulation. So the pathway you choose at C depends on B, breathing yes, breathing no. But to get B right, you must have an open airway. Hence, as Doctors ABC, you identify and treat as you find in the correct sequence. Now, you might even get as far as C. A story I like to cite, about 20 odd years ago, my wife and I and children were dining at a restaurant, and as we left the restaurant there was a pub fight on the other side of the road. Knives and bottles being wielded. Doing my danger assessment, I felt it was actually unsafe to approach the scene, so I asked my wife to put the kids in the car. I called the police and I waited, so I communicated and I waited. Now when the police actually turned up, then together we assessed the actual patients and dealt with them. So what do you mean by assessing the patients? Well, we just got our doctor's ABC protocol. So quite simply, as you approach the scene and the area is safe, if the person is screaming and shouting and talking to you, they're responsive. If they're screaming and shouting, their airway's fine and they're breathing, they'll probably tell you what to do. Oh, I've cut myself, put something on that, or don't move my leg, I think I've broken it. So guess what? You do what they tell you. Life is easy. If they're unresponsive, you know that because after you shake and shout, there's no response, and you open their airway using head tilt chin lift, as demonstrated here, but they are breathing. They're alive, there's no obvious bleeds. You then put them on their side, and how you do it, quite frankly, we don't care as long as they're on their side and you do it so safely. But the easiest way is what's termed the recovery position. However, if they are not breathing, you breathe through them, and if they're dead, you leap on the chest and you hope for the best. You undertake in effect CPR after ensuring an ambulance has been called. That's what I mean by doing a doctor's ABC. And it literally is as simple as that. So when your mind goes blank, and believe me, your minds will go blank when attending an emergency. I've attended tens of thousands of calls in my lifetime, and my mind still goes blank occasionally. If when your mind goes blank, you can remember doctors A, B, and C, and for Christ's sake, we can't make it simpler than the alphabet, you can save someone's life. At this level, that's what first aid is. Doctors A, B, and C. If you're watching this video on our YouTube channel, please click like, share and subscribe. If you want further information regarding courses that we run, venues, dates, etc., please look at our Facebook page, Holos Healthcare and Training Limited, or look at our website, holoshealthcare.com. You could follow me on my Instagram account, YodaBraz, or you can email us directly at holoshealthcare@gmail.com. Or the old-fashioned way, call us on our office number during office hours, 0800 007 5248. Holos Healthcare and Training Limited, empowering people to help save lives.